We're moving on now to talk to a patient, and this is John Donoghue, who's kindly joined us today. He's been doing some work with Thrombosis UK. And as I was just saying to John, his talk is going to follow on so nicely from Bashkar's talk, and you'll see why as John talks. I'm just going to tell you a little bit about John, and then we're going to be doing a bit of an interview style session, which partly just indulges my lifelong ambition to be a BBC presenter. So thanks for that, John. But also, hopefully, we'll get to the crux of John's experience as well as we chat. So John is 57 years old, married to Caroline, who's been a midwife for over 35 years, and they live in Bognor Regis on the south coast of England. John has two boys, George, who's 21, and Charlie, who's 13. And last July, John was admitted to hospital with large volume bilateral PEs. Since his return from hospital, he's continued to experience prolonged bouts of pain and tiredness. Prior to admission, John ran a sales consultancy business, but this has been mothballed since the diagnosis, as the ongoing symptoms have prevented him from returning. Although you've just shared the news that you have been able to start doing a little bit of work, John.
Absolutely.
Welcome, and thanks again so much for joining us. Like I say, this is going to help to really give us that perspective on what happens to our patients and what does it feel like once you are discharged from the hospital. So first of all, just to give us a brief overview of your experience, John, could you tell us what it was like to have a pulmonary embolism, please?
Yeah, it was a shock. Obviously, that goes without saying. I think it's good to talk about the pre-diagnosis event leading up to it, because I think it's really, really relevant to once you've got the diagnosis and ongoing. I got bitten on my leg. It was during COVID, obviously that warm spring, summer, and all the warm spring. Sorry, I'm getting all muddled up. And I got phlebitis. It spread up my calf into my groin. At which time I had a edema. It came back raised. I had a scan. It came back as completely clear, and I was, left to my own devices. I kept on getting pains in my stomach and in my groin, and both groins, and I kept on being told it's not an issue. I was even told I was fixating about my leg and I should see a mental health nurse. And indeed, 24 hours before I went into to A&E, I was told I had IBS. Long and short of it, I woke up one morning about 4 o'clock in the morning in massive pain. I genuinely thought I was having a heart attack. My wife drove me to St Richard's to the A&E, and I got in there and they quickly brought me in, and I explained I had a pain in my left side, and the triage nurse turned around and said, "That's not your heart, that's your lung." Next thing I know, I'm on a trolley, and then I pass out, come to, and long and the short of it, I was diagnosed, as you said, Emma, with large volume bilateral PEs. And it was incredibly scary. I was in the acute cardiac ward for 7 days. And then I was discharged, and really and truly, and I know we're going to talk about this, left to my own devices. It was literally a case of thank you and goodbye. And since then, really and truly, up until a month ago, I was really suffering awfully with, really bad pains in my chest, in my back, in my arms as well, and huge periods of fatigue. I think I said to you previously, like Jason and the Argonauts, when the big robotic warriors, that he undoes the Achilles and all the oil boils out. That's how I felt time and time again. And I kept on being told, oh yeah, it might be this for 3 or 4 weeks. When I went and saw my GP, then it went up to a couple of months. Then it, at 6 months, I was referred on. And I've been under the auspices of a respiratory consultant and also a cardiac consultant. And that's where I am at this moment in time. I can't even sleep on my side because I get pains in my chest and I get woken up. That's still there, but the tiredness has gone and or diminished quite a bit. Whenever I exert myself, I get the pains, and they can come on at any time, just sitting in a chair. And that's where I am at the present moment. So 16 months down the line.
Yeah, long old journey.
Yeah.
Can I take you back to that time, John, where you were in the hospital and in the emergency department, and they gave you the diagnosis of having bilateral PEs? Do you remember at the time what was running through your mind and how you felt? And was that something that you were, did you know what that was and what that could mean for you?
In answer to the second part of the question, did I know what it was? I had a rough idea. I knew that clots were not good, and if they was on your chest and lungs, sorry, that was doubly not good. But strangely enough, when I was told, the minute I was, the lady, the nurse, triage nurse turned around and said, "It's your lungs." All of a sudden, I put two and two together. I don't know why. I just, and my initial reaction, I know it sounds incredibly strange, but it was actually relief, because I actually felt, oh my God, there is something wrong and I'm not making it up. And I go back to everything, it is this post. They talk about, the clots being a sort of impersonator disease, and, it mimics so many other things. But it just seems to me, since I've been with Thrombosis UK, etc., the experience of so many people is that they have to fight to be believed. And in most cases, they're not until they get to hospital. Saying that, as I, mentioned previously, the minute I passed out, I was in huge amounts of pain. I passed out. I came to, there was so many people around me. And then I was taken to the CAT scan by an ITU consultant with a crash pad. And all of a sudden, I'm thinking, I might have been lots of morphine, never had morphine in my life. But even with that, I thought there is something not right here. And boy, was I scared. And then to be put in, they found a space for me in acute cardiac, and it was COVID. I had no one, my wife couldn't be with me or anything. I was just the most frightened I could ever be. So that's how I felt.
Yeah, no, I can imagine. It sounds terrifying. Lots going on around you, and like you say, certain signs make you realize the seriousness of your condition, such as people going around with crash pads, as you said. And whilst you were in hospital, obviously you were put on treatment for your clots. Did you receive more information, and did that help you to get your head around what was going on in that time that you were in hospital?
In hospital, no. I was just told that I got sorry, I do beg your pardon.
Don't worry, it happens.
I got told I got large blood clots, and that was it. I just found it very, very difficult. I felt alone. I felt in limbo. I got nothing. I got nothing whilst I was in hospital, and I didn't get anything subsequent to that either. When I left.
That's a shame. That's a real shame to hear that. Some missed opportunities there. I know when you're acutely unwell, it can be quite difficult to take in large amounts of information, but also it's a great opportunity, isn't it, while you're actually there in hospital, to get the information that you're going to need. Once you were discharged from hospital, how did you find the subsequent weeks and months following your diagnosis?
Well, I found it very difficult. I found it difficult on three sorts of levels. Obviously, I was scared. I had lots of pain, and I wasn't expecting that. And the reason why I wasn't expecting that is because going back to the education when I was in the hospital, I felt really confused. I've told you how scared I was. Having all the crash team, being in acute cardiac, and I couldn't leave my bed, couldn't move for 2-3 days, and everyone's concerned. But I got these mixed messages, because I got told by the consultant cardiologist who I was under that oh, you know, it wasn't that bad, it wasn't life threatening. And when I got discharged, I was told, you know, I can just go back to living how I was. And that confused me because, you know, I had all this pain and I wasn't expecting it. And I was scared as well because I felt alone. And all I was given with regards to information about anything was a 5-minute talk with the hematology people about apixaban. And that scared me even more because, you know, out of the blue, I was told I was going to be on blood thinners for the rest of my life. I couldn't cut, you know, God forbid I cut myself, God forbid, you know, I hit myself. And indeed, you know, there was no signposting of anything about support. And I remember I came out and I looked up PEs. I thought there's bound to be something, you know, like the British Lung Foundation, British Heart Foundation. I looked up PEs, obviously the wrong thing. There was nothing. I got in touch with the British Lung Foundation. They turned around, the lovely person turned around and said, oh, that's not really our bag. There must be something with PEs. And she looked up and she went, oh no, there's not. You know, it's there, nothing, and not even any follow-up. And you know, it just, I was quite amazed and quite shocked. And it was only literally about 6 months down the line that I found out about Thrombosis UK.
Mm.
And so, you know, scared, confused, and alone.
Yeah, and obviously, I'm sure it's coming across that your symptoms persisted, didn't they? So sort of, you know, and up until now, you've still got symptoms, and that's being investigated, isn't it, John?
Yeah, absolutely. I mean, you know, I can't fault the amount of treatment I've had. You guys are going to know. I've had 3 or 4 CAT scans. I've had, excuse my ignorance, I've had a nuclear scan or whatever it's called, a DX or whatever. Yeah. I've had is it a right-sided catheter? It's a bit, and the great news is I haven't got hypertension. But they know what I haven't got. But at the same time, I keep on, and this is the other bit for me, and it's, you know, it's not knowing what happened. It'd be lovely to sit down and somebody tell you and show you. I've briefly seen a scan of my CAT scan when I was admitted, but you know, I'm a layman. You know, oh yeah, look at that information. I can't see I can see the information around the edge, but what was a lumps or whatever, I have no idea. And it's not knowing what to expect. And a classic example of that is I knocked my head. I walked out into the garden and went into the shed, and I knocked my head on the, you know, I'm quite a tall guy, and I knocked my head on the door as I went in, and I panicked. I thought, oh my God, you know, and I went to hospital, and I took up time, you know, and it scared me because I went there, I said, I've knocked my head. Straight away, even though this is in COVID, I'm put into a special room. I'm given a CAT scan again. They're talking about putting me back in hospital. And I'm thinking, oh my God, you know, am I that ill? And is this how my life's going to be and I had no points of reference.
No, it must have felt quite lonely.
Yeah.
I think you sort of touched on some things, some challenges throughout the process, but is there one thing that you can pinpoint as being the most difficult thing about the whole experience?
Yeah, it really is a sense of abandonment. It really does feel to me. God, I don't want this to come across as selfish or anything else, but you know, if you had a heart attack, there seems to be a program. God forbid if you had cancer or whatever, you know, you've got some form of signpost. You know what's there. There's nothing in my hospital. You know, I can't fault. Please don't get me wrong. I'm not here. As I said, my wife, 35 years, nearly 40 years as in the NHS. You know, it just seems as if I fall through, or people with clots fall through the gap between respiratory and cardiac, and there's nothing in between. I mean, I know that you're anticoagulant and clots. There's nothing like that. And I look at that and I've asked, and it seems to me to be that, oh yeah, you guys look at preventing them, and the cardiologist and the respiratory pick up the effects of if you've had them. But they both seem uncomfortable, and don't really know, I suppose. And of course they do. These are incredibly intelligent and exemplify everything that's great about our medical. But it feels as if there is a big crack in the floorboards, and DVTs, PEs, whatever, fall through. If you don't get better, if you're at the end of that bell curve, there is nothing there.
Yeah. And I think we talked before about the fact that in different hospitals, the follow-up can happen very differently, can't it? In our hospital, we have haematologists who follow up all patients with clots, and elsewhere, like you've said, it might be respiratory physicians, cardiologists, some areas it might be GPs. And I suppose unless you are very clearly signposted as to what sort of pathway you can expect when you leave hospital, and what you can expect to happen if you don't get better, then I guess you are left a little bit bewildered and a little bit lost. Was there, I know that, going through what you've gone through has been an enormous change and impact on your lifestyle. Is there anything in this experience that has been positive at all?
I'm finding it hard. I mean, there's the given of the care that I've received. It's faultless, and my GP, has always been there and referred me on, but because it seems to me that there's not a lot of training. Yeah, it's going to hurt. It should hurt. If it's hurting after this, Matt, you go to I'll refer you on to a respiratory. But at the present moment, I think I'm too far. I'm still in it, Emma, and I'm feeling down about it. Don't get me wrong. I'm grateful I'm here, and I'm sitting here, and I'll take every day as a blessing in that respect. I'm not a religious man. It's I understand it can be far, far worse, and it's not a case of woe is me. But at the present moment, I'm sorry to say I can't turn around and say it's made me focus on being able to overcome issues and challenges.
Yeah, no, that's understandable, John. Well, I think you've frozen a little bit there.
Because I don't feel like
no, we got you back.
Oh, that's you saying I'm bored now, John.
Not at all. No, I think that's perfectly understandable, and I think I said to you before that in some of the work that's been done in looking at how people have
now you've frozen.
Coped. Oh right, am I back?
I can see you. Okay.
You can see me.
Yeah.
I'll tell you what, I'll turn off my video and see if
all right, John. All right, let me move on to the next question. Is there anything, I think as healthcare professionals, what we're really interested in is what we can do better for people like you. So is there anything about your experience that could have been improved?
Yes. I think the two takeaways that I would like to give is education, which is this, which and I'm so grateful for the opportunity to be able to give my voice amongst many others. It's just a fact. Even going back to the start, if you turn around and say we talk about it being a mimic of a disease or an ailment, just keep it in the back of your minds to start with, everyone, because once you review what is the probable cause and you find that it isn't, then think about the improbable. I mean, the big flag for me was my scan came up as negative. So that ruled, as far as everyone was concerned, I didn't have a DVT. And so that that was the end of it. And then it really more communicative to the patient, because you might know all of this information and it's nothing new to you. You might be sitting there and going, yeah, you know, there are people that are 3 months, 6 months, 12 months down the line who do suffer, but nobody tells you that. And I don't think it has to be scaremongering. I think you know, you turn around and say, you know, 60-70% of people go back to being their old selves within 3 to 4 weeks, but there is a chance, and this is that, and this is what you can expect to have. And it's just communicate, because if you've got some form of communication, then I as a patient don't feel confused, I don't feel alone, and I don't feel scared. And you know, it's just that.
Yeah, so it's about having information and having a contact point when you have got questions. Is that right?
Yeah, yes, but I know that that's resource hungry, and I know that the NHS isn't, you know, awash with money. But even just the signposting to say Thrombosis UK,
Yeah.
you know, that would be, because you know what, and I've forgotten the lady's name that was when I phoned up, but it was so emotional just to hear that I wasn't the only one. It was just incredible, and you know, I'll forever be thankful for that. And you know, just that signposting, so that you've got some information.
Yeah, no, it'd be good to know that this sort of specific type of information, actually, John, that you would have found useful, so that that can dictate the types of information that we're giving to patients and the resources that we create for patients as well.
Yeah.
Yeah. We've got a couple of questions coming in, John, from the audience. First of all, somebody has said that you're very brave, and sometimes you just have to tell people that you are not making it up when you're feeling those sorts of symptoms. And some people, they don't believe you. And I think I said to you that again, going back to the qualitative research that's been done around thrombosis diagnosis, lots and lots of people have been in the same position as you. It's a very non-specific symptom set, and therefore can get mistaken for lots and lots of other things. And you've shared with us a couple of things that it was mistaken for in your case, which, you know, some of them you kind of, in hindsight, you kind of think, well, that was a bit bizarre. But obviously everyone's doing their best to try to help you. But I think that's a message though, isn't it? That when you know that something's wrong and you've got that instinct, you need to be quite tenacious sometimes in seeking help and not feeling fobbed off.
Absolutely. Do you know what? You know, I can represent myself and articulate how I feel, but the trouble is, you know, especially in both post and pre, it really is a case of trying to understand and get through to people that, you know, please take me seriously. It's something, do you know, I got told I had to make an appointment. It's at my ex-practice now, but when I came out of hospital, I made an appointment, and I turned around to the person that told me I had IBS, and I turned around and said, well, what can I do now? And she had great delight in saying, well, listen to your body. And I thought, oh my God, that's what I've been doing all the time, but you wouldn't listen to me.
Yeah.
And how do you overcome that mindset? And that's what I say, when the improbable is the only thing left, then please, 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 you know, consider it.
Yeah. Yeah, and I think you talked about in your testimony as well, that the impact that frustration has on you before you even get your diagnosis. So by the time you get your diagnosis, you're already in perhaps a negative state of mind, which obviously doesn't help you then process that new diagnosis. Another question, quite a specific one. The new national guidance looks at, it tells us that we need to see people like yourself, John, who are on long-term anticoagulation every year, just for a follow-up. And one of our colleagues has asked what you think about that, and what form should it take? And I suppose in this COVID era, I'm wondering whether virtual clinics, so on the phone, you think would be suitable, or whether face-to-face would be better?
I think there's two parts to that, actually, Emma. I think you can do it. I don't think it needs to be face-to-face. I think you can do whatever needs to be done virtually. That's not a problem. But the questions I have, and it's a question I had, because I got told that my main clots have gone, but they've dispersed into the peripheral arteries, if that's such a thing. I think the apixaban is actually working, because I was told when you cut yourself, boy, you bleed. And I've cut myself 4 or 5 times, and it's slightly worse, but it's not that bad. And I'm saying, and I've got somebody at the rugby club shaving, I nearly went to hospital because it just wouldn't stop. And so I'm thinking, is it work? I keep on saying, no, there isn't, but it's doing the job. And it's that sort of thing, because you feel, again, you just don't know.
Yeah.
And you don't know what you don't know.
No. Several messages, John, thanking you for taking part and for raising some of these really, really important issues. And somebody said that we tend to forget how important it is to keep our patients at the centre of everything we do, and give better explanations of the condition at the time, and follow-up and information is vital. And I think that's hit the nail on the head, really.
Yeah, I couldn't agree more.
Yeah. John, I can't tell you how much we appreciate you giving up your time to be with us today and giving us your perspective on what it's like to have a blood clot. Another person saying thank you very much for sharing your experience. It is brave of you, and we wish you all the very best in your recovery, and hope that you do get back to being yourself, back to being John again.
That's very kind of you, Nick.
Any last comments to add, John?
Absolutely, it's very kind. It's been, oh, sorry Emma, I've got a bit of lag. It's just been an honour to be able to share my story, and if it's been able to help and enlighten people, or at least show the causal effect, then I'm glad I've been able to help. And good luck with everything you guys do, and Joe, what you do with Thrombosis UK. And if I can help in any way, I'm always here, and it's been a pleasure.
Really appreciate that, John. Thank you very much.
Thank you, John.
Thank you.
Thank you.
The best. I'll leave the meeting.
Thanks, John. So I hope you found that useful. I think that we don't really get to talk to patients very long, do we, when we're perhaps seeing them in clinic. We get a short amount of time, and we're very focused on perhaps physical symptoms. And for John, obviously, the physical symptoms obviously had a big impact on his quality of life. But it's really nice to be able to spend a bit more time and really dig a bit deeper into what's going on for him, how it's affecting him, his lifestyle, and the knock-on effect on his family life and his work for him as well. So really important, I think, for us to bear that in mind when we're looking after patients